Have you ever wondered why your body might not respond to insulin as it should? Today we're exploring the intriguing world of insulin resistance and diabetes. These health conditions are surprisingly common, impacting countless lives around the globe. They hold the potential to drastically affect our health. And yet, understanding them is often clouded with confusion. So, let's clear the fog. Let's dive deep into the world of insulin resistance and diabetes and understand what it really means. So, what exactly is insulin resistance? To answer that, let's first understand what insulin is and what it does. Insulin is a hormone produced by the pancreas. Its primary function is to help our cells absorb glucose, the sugar our body uses for energy, from the bloodstream. Now imagine a key and a lock. Insulin is the key that unlocks your cells to let in glucose. But in insulin resistance, this key doesn't work as well. Despite having enough insulin, the locks on your cells become less receptive. This means glucose can't get into your cells as easily and builds up in your blood, leading to higher blood sugar levels. Over time, the pancreas tries to compensate by producing more insulin, creating an excess. But if this condition persists, it can strain the pancreas and lead to more serious health issues, including type 2 diabetes. Insulin resistance is not just a term, it's a serious health condition that can lead to various complications if left unchecked. Now that we understand what insulin resistance is, what causes it? The roots of insulin resistance are varied and complex, often intertwined with lifestyle choices and genetic factors. Obesity is one of the most significant contributors. Excess body fat, especially around the waist, has been linked to insulin resistance. This is because fat cells, particularly those in and around the abdominal area, release a type of protein that can disrupt the function of insulin. Then, there's the issue of physical activity, or rather, the lack of it. Regular physical activity helps control weight, uses up glucose as energy, and makes cells more responsive to insulin. However, when you lead a sedentary lifestyle, your body's demand for insulin is higher, and this can lead to insulin resistance over time. Unhealthy diet is another heavy hitter in the causes of insulin resistance. Consuming high amounts of processed foods, saturated fats, and sugars can cause weight gain and inflammation in the body, which can impair the body's response to insulin. On the flip side, a diet rich in whole grains, fruits, vegetables, lean proteins, and unsaturated fats can help maintain a healthy weight and keep insulin levels stable. Lastly, we can't ignore the role of genetics. While lifestyle factors are crucial, some people are genetically predisposed to insulin resistance, especially those with a family history of type 2 diabetes. This doesn't mean that if your parents or siblings have diabetes, you're destined to develop insulin resistance. But it does mean that you may need to be more mindful of your lifestyle choices to prevent it. So, in a nutshell, insulin resistance can be triggered by obesity, lack of physical activity, an unhealthy diet, and genetic predisposition. But the good news, except for genetics, most of these triggers are modifiable. We have the power to make choices that can protect us from developing insulin resistance. As we see, several factors can contribute to the development of insulin resistance, many of which are under our control. If someone has insulin resistance, how would they know? What are the symptoms? Insulin resistance often starts with subtle signs, which may be easy to overlook. You might feel a little more tired than usual, have a craving for sweets, or notice that you're not losing weight even when you're watching what you eat. But as insulin resistance progresses, the symptoms become more apparent. One of the most common signs is weight gain, particularly around the waist. This is because insulin plays a crucial role in regulating fat storage, and when this system is out of balance, weight gain can occur. Another symptom is increased hunger, especially after meals. This happens because the body's cells aren't effectively using glucose from the food you eat, leaving you feeling hungry even though you've just eaten. High blood pressure is also a common symptom. Insulin resistance can cause the body to retain more sodium, leading to increased blood pressure. Over time, these symptoms can lead to more serious health conditions like prediabetes and type 2 diabetes. Prediabetes is characterized by higher than normal blood sugar levels, but not high enough to be considered diabetes. If left unchecked, prediabetes can progress to type 2 diabetes, a chronic disease that can lead to heart disease, kidney disease, and other serious health problems. Recognizing these symptoms early can be key to managing insulin resistance and preventing further complications. Insulin resistance sounds scary, but there is hope. How can it be treated or managed? Let's dive right into it. First and foremost, let's talk about lifestyle changes. Yes, the way we live, the food we eat, and the activities we do play a significant role in managing insulin resistance. A healthy diet, rich in fruits, vegetables, lean proteins, and whole grains, can help regulate blood sugar levels. Regular physical activity, be it brisk walking, swimming, or even dancing, can also assist in keeping insulin levels in check. Now, what if lifestyle changes are not enough? That's where medication comes in. Doctors often prescribe metformin, a common medication used to lower blood sugar levels in people with insulin resistance. It works by making your body more responsive to insulin, thus helping to manage the condition. But remember, medication should always be taken under the guidance of a healthcare professional. In some cases, surgery might be considered, especially for individuals dealing with obesity-related insulin resistance. Procedures like bariatric surgery can help lose weight and significantly improve insulin sensitivity. But surgery is a big step and should only be considered as a last resort after lifestyle changes and medication have been tried. Early diagnosis and intervention are crucial in managing insulin resistance. The sooner the condition is identified, the better the chances of preventing or delaying the onset of type 2 diabetes and other related health issues. Regular health checkups and blood sugar tests can be instrumental in detecting insulin resistance early. And let's not forget the role of stress management and good sleep in all of this. Chronic stress and lack of sleep can worsen insulin resistance. So, practicing mindfulness, getting adequate sleep, and keeping stress at bay can also be part of the treatment plan. While insulin resistance is a serious condition, it can be managed effectively with the right treatment and lifestyle changes. Remember, your health is in your hands, and every small step towards a healthier life counts. So let's take that step today. We've covered a lot today about insulin resistance and diabetes. Let's review the main points. We delved into understanding what insulin resistance is, a condition where the body's cells do not respond properly to insulin and thus can't easily absorb glucose from the bloodstream. The primary causes of insulin resistance include being overweight, leading a sedentary lifestyle, and having a diet high in processed and sugary foods. We also discussed how the symptoms of insulin resistance can often be subtle and easy to overlook, such as fatigue, hunger, and difficulty concentrating. However, long-term insulin resistance can lead to serious health conditions like type 2 diabetes. And finally, we explored the various treatments available. These range from lifestyle changes like adopting a healthier diet and regular exercise, to medication and even surgery in severe cases. Remember, knowledge is power. Understanding insulin resistance and diabetes can help us make informed decisions about our health.